I think that India and Indians, Indian activists, Indian government officials have a significant role to play in the global discussion about access to medicines. There is undoubtedly in the future, it's about these big countries. It's about Brazil, Nigeria, Indonesia, India, China. These are the countries that have what I call sort of mega populations. It's not a new concept. We know for a long time. And so, even for these countries for them to even provide 1% of their population something, it's a significant amount, right? So for us to be able to say something like everybody's going to have universal health coverage in these countries, we're talking about phenomenal amounts of resources here. And so the question is, what are the global actors and the regulations? Are they supportive or not towards that kind of project? And I think that what's going on, and this is obviously the private actors have been far ahead in this, is that they've been looking forward and saying, okay, Nigeria is going to grow at this rate and they're going to need vaccines. So where are they going to get those vaccines from, and how are we going to make sure that we're there when they have it? So, but the governments in these countries have not been so far ahead and thinking about how are we going to procure it, how are we going to pay for it, how are the infrastructure and all that stuff. So I think right now is the time in which sort of India and Indians and all these other countries could have a significant leadership role in terms of sitting down and saying we need to think about this in a much more productive and consistent way in terms of, what are the numbers that we're talking about? What are the different kinds of basic components of what we would call universal health coverage about? How much will it cost? Where are we going to get it? And then if this confronts sort of the way that the international legal regime or trade regime or patent regime is, they need to open up a conversation and say we have to do this in a different way.